Bonjour à tous. Hello,
everyone, and welcome to this press conference about the present context of COVID-19 in Quebec and of the 4-tier regional alert system. The press conference will take place as such. The Minister of Health and Social Services, Mr. Dube, will first speak to you, and then there will be a question period with the National Director of Public Health, Dr. Horatio Arruda, as well as Dr. Eric Dube will also be available to be able to answer questions. Without further ado, Mr. Dube. Hello, thank you very much, Marjorie. Hello to everyone, and hello, Dr. Arruda. I find that we see one another very often nowadays, so thank you once again for being there, but particularly to be able to present to you another member of Public Health team, Mr. Dube, who is in fact one of the main people responsible for the strategy that we're going to be presenting today, the Regional Alert System strategy. So we found it important that people be able to know who he is. I think that you know we are getting ready and have been for many months now for a potential second wave. And today we're going to be presenting to you a tool that is not only going to be guiding our actions, but also our decisions. I'm talking about an alert system that we'll call a regional alert system with a 4-tier intervention system. I think that most journalists were able to have a look at it in the past half hour or so. The government wishes to reach 2 objectives, which for me, for the government, are very important. What we've been hearing since the first wave is that people want to have better predictability. They want to be able to know what's coming up. Because you're going to see later on, we're going to be showing you, we deconfined quickly, we confined quickly, and then deconfined, but it was difficult to have predictability. So that is the first point. And the second objective is to be able to help the public to become accountable in this context. So I'd like to summarize. Predictability and accountability. Nobody wants to come back to a confinement such as the one that we experienced last spring. I hope that people on television can follow. I was going to say the slides that shows how old I am. So the regional alert system that was developed is an alert system that is going to allow the public, as I said, to be able to follow us, but also not just the public, but companies, because we've seen it. There were economic impacts, there were impacts on our health system. So once again, the question of predictability is an important one. And what you can see here on the screen right now is that we have a principle where the basic principles, even if a lot of people don't like the expression, is our new normality. We started with, our normality 6 months ago, our real life, that's where we were. Then there was a very significant, massive confinement over a few days and then weeks. And over the summer, we went back up. So it's the orange curve that you can see here. So the new normality, I think that we've managed to gain, even if it doesn't make us entirely happy. That is really where we are in that new normality. With, as you can see in the second phase, peaks and valleys, as you can see, what Dr. Arruda calls little waves. But we know that the virus, its evolution, is not done the same, and it is not going to happen the same way everywhere. And unfortunately, the respect of health guidelines are not being followed in all regions in the same way. And that is really important. We need to get back to that. So I'm going to go to the second graph here. The alert system that was developed by Public Health a few months ago, and we've been working on it for many weeks now, and you'll be able to see later on some of the conclusions. We called it a 4-tier system because we want to be able to have that element of predictability. So 4-tier vigilance, where we are now in most regions, green. The pre-alert, which you can see, which is yellow. Moderate, which is orange, where it starts to be a little bit serious. And maximal alert, where we really don't want to go. And that is, as I explained last week, the same thing as for the system, of the possibility of forest fires. So a system of progression. The second tier for me is a first alarm system. That means, in fact, that transmission is starting to increase and that we're going to have to redouble in our efforts. You're going to see later on that there are already regions that are in yellow. It's unfortunate, but it is our reality. And third and fourth, orange and red, it's a progressive intensification. And later on, Dr. Arruda and Dr. Lidvac will be able to answer more specifically what that means. Another graph. So I talked to you about the different tiers. Let's talk about the criteria now. There are many factors that are going to allow us to follow the evolution of the pandemic. And we are going to be very transparent in a way that we'll be doing it with people. For a region to go from one tier to another, this is what we're going to have a look at. First, the situation that we call epidemiological. So the control of transmission is the second tier, or the second level, the second criteria. And the third is the capacity of the health system. There's also, and that is very important, if it wasn't a computer and we could just enter the data, it would be a great deal easier, but it is not the reality. The reality is that there's going to be qualitative analyses that will come and complete these indicators. Because 3 criteria are good, but I think that there are situations, specific ones that we'll be able to talk about later on. So to summarize, we have a multitude of factors that will be interpreted following the investigations done in the field. And I really wish to emphasize one point here. What I'm presenting are the basic criteria that allow us to see things come and to better see the trends coming up. And that is why in the middle of the graph, you can see so many, the trends, whether they be upward or downward. And recall a few weeks ago when we started talking about, the number of cases per million, it was to say, what is the trend in relation to that? And people, the journalists, followed that very well. But it is one of the many factors that will be following in those trends. Now I wish to repeat it. It's going to be sending very clear messages to people who follow us, messages of predictability. And that, for me, is very important. Now, what does this mean? An approach that is multi-tier. If we go from green to yellow, what we call in pre-alert mode, we might have, as an extra measure, for example, an increase of the control of access in certain public places. As of orange, we might reduce the number of people in private gatherings. I think that's obvious. At red, we'd be even more drastic. Maximal measures could be taken, for example, to stop the transmission. I would like to show you as well. I think that we could, I'm going to take a risk of coming back here. Hold on. If you look at the bottom of this graph, for me it's important because the measures that we announced when I was telling you that we were in our new normality, as you can see at the bottom, there can be adjustments of additional measures that we could, as we go along, even if we stay in the green, we could adjust certain measures. I'll give you examples later on. Or we could have temporary measures as well. So that, for me, it's important to mention, and I had perhaps forgotten to mention it earlier on. Now, this is important, and that's where we are at today. So the model that Dr. Lidvac developed together with public health and with the entire team of Dr. Arruda, we tested and have been testing it for many weeks, and you can see, I'm going to go to the conclusion right away. You can see that we're talking here of certain regions that have already been in the yellow zone. Let's think about Montreal, for example, La Naudière. I'm looking at the graph as at the same time as you, but the good news is that over the past few weeks, there's been positive evolution. And that is important, and we'll be able to get back to it if you want me to put it back on the screen later. But today, and we're going on a weekly basis, if we look at the week that ended on Saturday, all of our statistics that are becoming more and more public are always from the Sunday to the Saturday. So the week that you can see here that ended on the 5th of September, we have 4 regions of Quebec that are in the yellow zone. So the National Capital Region, the Estrie region, the Outaouais region, and Laval. If we look on a map that is even more clear, it's not just in Montreal, but everywhere in Quebec, and that is what we have to prevent, and this will be updated every time. I would like to talk quickly to municipal elected officials with whom we've been talking a lot over the past few days to warn them of what was going to happen and the plan that we were preparing and that we are presenting today. There's been a lot of collaboration, and here I'd like to take a break. There's been a lot of collaboration between regional public health authorities in the first wave of speaking either, with the CEOs of the CIUS and the CIS, and the regional authorities and municipal elected officials. In light of where we are right now, I think that we have to start taking up these discussions again with regional public health authorities. For example, if I'm the mayor of Laval this morning, or of the Outaouais region, those municipal elected officials are we're going to go into contact with them, with the regional public health, to explain to them in detail what the model is and to talk about how and what we can do to get back to the green. What are our leverage points? So this is a request that we had a lot, and we talked about it a lot with Dr. Ruda and Mr. Dube. It's going to be done over the next few hours to make sure that we can explain this. To conclude, those who may doubt it, the virus is really there. It truly is still present. Contamination is at community level. And because it is at community level, it is everywhere where we live and in our healthcare systems and all the way to our schools. And I would like to repeat that. The contamination right now, the spread is community. And that community spread has an impact on our living environments, on our healthcare environments, and on our schools. So, the government, we have concentrated in securing our living environments, our hospitals, our schools, so that we can go back to a more normal life. But now, however, Quebecers, each and every one of us, is responsible and accountable for action so that the virus spread as little as possible. And for me, that is really important. Earlier on, I talked about visibility, and now I'd like to come back to accountability. It is accountability that is important here, and responsibility, because this means it's a win-win situation. If we stay in the green zone, if we respect the health guidelines, we prevent the virus from infiltrating itself in our schools, in our living environments, and we also protect our healthcare system because it was made more frail. It took a blow. But we also make sure that we can continue with our activities with a certain level of normality. For me, the solution is a simple one. In each of the regions, each of them, the solution is in our hands. I'm not going to do a play on words saying that, we shouldn't wash our hands of it. We have to, on the contrary, continue washing our hands. All Quebecers have that power, and I want to say that very lightly. All Quebecers today, with the analyses that we've just conducted, have the power of fighting the virus, and each and every one of us can make the difference. Thank you very much. I'm going to say a few words in English.
Today, we're pleased to unveil a tool that will guide our decisions and action over the coming month. I'm talking about the 4-level systems of regional alert and intervention that have been developed by our colleagues in the public health group. Dr. Lidvac and Dr. Ahuda, thank you for all the work that have been done in the last month for that. The 4-level regional alert system will guide the measure that we take. The system include, and you've seen the slide, a green level for vigilance, a yellow levels for an early warning, orange, which is a moderate alert, and unfortunately, we don't want to go there, but a red level, maximum alert. Now then, a number of different indicators that will allow us to follow the evolution of the epidemic and decide whether or not we want to change, and we have to change the levels that are warranted. The criteria are based on the following 3 criteria. The epidemiological, that's a tough word for me in English, even in French. The control of transmission, the second criteria, and the capacity of healthcare system. We need criteria to enable us to monitor conditions and as they arise and improve how we recognize the trend. Those levels will be reviewed each week by public health authorities, and those levels will be discussed with our municipal level, so mayors and MRC will be aware of what's happening and how they can have visibility, predictability, and action that can be taken at the municipality level, which is very important. All changes will be made public, as clear as we observe outbreak in all Quebec region. That's important to say. We are observing an increase in public eclosion, as we call it in French. So, I repeat, health instructions need to be followed. Each and every one can make a big, big difference in containing the virus. We are all responsible for our acts. I want to thank you very much, and now we'll go for questions. Thank you.
Alors, nous allons maintenant débuter la période de questions des journalistes.
We will now be starting with the question period.
Une seule question par média. Donc, s'il vous plaît, précisez votre nom, votre média et à qui s'adresse votre question. Nous allons aller avec le micro 1 pour commencer.
Bonjour à vous, Philippe Bonneville du 98.5 FM. Monsieur Dube, on s'est parlé la semaine
Mr. Dube, we spoke last week of the number of cases that is increasing day by day. We talked a lot about the 7-day mobile average. We're now over the 160 cases per day on a mobile average. 120 schools are affected by at least one case. Mr. Dube, I'd like to ask you the question, as well as to Dr. Ahuda, we talked a lot about levels today, but what is your level of worry today following how things will unfold? Well, the first thing I told you, I'm not going to keep it from you, I am worried, but I am constructive. So that system that we are proposing today, it didn't just come up, from one day to the next. We've been working on it for many months, as I told you, with the team. And as you can see, I put the graph back on the screen in order to show how things have evolved. One of the reasons why, and you'll remember, I've talked about it already, but we went with a mobile average, is that things can change very quickly. Yesterday we had 215 cases, today we have 173. I take it with a grain of salt, because we're in the days following a long weekend, and all the tests come in. There are a lot of factors, so we have to take a step back, and that is why we look at all the criteria. I think that what we are giving Quebecers today, and I appreciate your question, for me, the number of cases per million inhabitants is one of the factors, and we had said to you, this is one of the things that we're looking at, but there's a lot of other factors. There's a number of outbreaks, and after that I'll be able to give the mic over. But I told you last week that what worried us the most over the past few weeks was the number of outbreaks. I had compared it, to little forest fires, and the more that there are, the more difficult it becomes for those people to control everything. And I'm even more worried about this. So the number of outbreaks and their size, that is in the second criteria. And I'll stop that to just say that that is why in our 4 regions that we are presenting today, there's enough of those conditions to put them in surveillance mode.
Dr. Arruda,
Rapidement, le ministre l'a bien expliqué.
Quickly, because the minister explained it very well, it has to be understood that, as we said, there's a series of criteria. If we look at a patient, for example, and we see, he's got 140 over 90 of blood pressure, that's, not the only thing we look at. We have different tests to see whether they have diabetes, etc. So we're doing the same analysis. And independently, in order to be more reactive than the data, with the Director of Public Health, we have conversations that can take place 2 or 3 times per week and sometimes every day, but to see what they are detecting in terms of phenomenon. It's true that there are 120 schools where there is one case, but these are cases that came from the community to the school. It's not transmission in the school itself. If there is transmission in the schools, that would be something else, but that is how we would adjust the elements. What the population has to keep in mind is that if the region is in the green, we have to continue with good efforts in order not to get in yellow. But if you are in yellow, you have to multiply the efforts. Distancing, mask, slow down the parties and all that. So basically, with these multi-tiered system, I can tell you right away what the minister said, and I said it in the Côte-Nord and in Saguenay-Lac-Saint-Jean. It's not because they had no cases there that they shouldn't think that the virus is there. The virus is present. It's a traitor, is going to be stabbing us in the back. So we have to install these different tiers, and the population, should know it's not because we're in green that we have to stop with the measures. It means that we have to maintain them in order not to get to the yellow. And the hope that we have, as the minister was saying, is that we can get to the yellow but go back to the green because we managed to control the outbreaks, and we need the public. And the last message, if you'll allow me, when the public health teams call you because you've been in contact with a case, or you have to say the contacts that you had, you have to collaborate, because that is how we can cut down the transmission chain and, avoid these little copses and groves to become big spread wildfires. Last week, the mayor of Montreal said Montreal is not just one reality. There are different things depending on the region in the city. Could your color code be applied to sub-regions as well, like a neighborhood in Montreal? And concerning the 4 regions, can I understand that for the time being it's really administrative regions. If somebody's in yellow, could there be a lack of control of access to certain public places, as you said? So the people who are in yellow, how will those be known by the people concerned? Will the police officer be called to be able to call upon measures? Well, that's a really good thing. You asked 2 questions in your question. You have the right to do that, and I'm going to try to answer. As far as Montreal is concerned, and I will call it a sub-region within a region, it is obvious that when I look at a region such as Montreal, or regions such as the Montérégie, where there's more than 1.5 million inhabitants, it's very broad. When we think of the Laurentians, yes, we're working with our 18 regions that we show, but of course we're going to have to go into sub-regions as well, because conditions can be very different. Today we're presenting this to you, but within the teams there will be discussions taking place. And I talked about it just yesterday with Ms. Plante, because within Montreal there are important differences that have to be taken into account. The good news is that Montreal, and I'm very happy for Montreal right now, that Montreal is still green. But we know where we have to be careful. We know the sub-regions where we have to be prudent. So yes, your question is very appropriate. We will have sub-regions, and we will be taking those into account. That's for the first aspect of your question. On the second, it is so... I'll repeat what I said, and maybe I wasn't specific enough, and do not hesitate to ask the question again if so, but we absolutely have to make sure that people understand that it's their role. I don't know if I've said it enough this morning, but people have to understand that it is their role, and if we are able to get that message out. I saw too many cases in the past few days, and we talked about it a lot internally. Maybe I'm not answering your question, but well, for the people of Laval and of the capital region and the eastern townships, They're learning that they are in yellow. Are there restrictions that they did not have until now? Will they now have restrictions? And in which way is it going to be applied? Is it the police officers that are going to have to do it? Those who don't know, those who aren't listening, for example, right now, and don't know. How would they know? Well, there are answers that I can give you today of what it would involve for those regions. I'll come back here. In level yellow, when we're talking about basic measures that are reinforced, well, of course, there's going to be more inspections. That, for me, is quite clear. Inspections that come from, and I can tell you that today, there's going to be more inspections that will come from the CNEST or public health with the different teams. But what we have to clarify, two things, with public health. So with the group, the the deputy premier, she will be announcing more coercive measures. Not that I like the word, but we said that we'd been patient enough over the summer because it was summer and we had seen that there was no significant spread. What Ms. Guilbeault is having a look at with her team right now is how she's going to bring together a progression of those measures together with her color coding. So is that clear? Today, I can't give them to you. But we've seen it over the past few days. We've already started giving more penalties, tickets, because we know that when we get to yellow, we have to start doing that. So now I'm being a lot more specific. It's not because we want to target those regions, because often we see it's so limited to a small number of individuals that I don't want to blame the entire region. But you understand what I mean. That is why I'm being very prudent. The last level, and that is why I put the graph here on the screen, there will also be additional measures that will be announced over the next few days. But I really wanted to be careful today because we're waiting for answers from public health that are going to be coming very soon on certain elements. But I wanted us today to be able to make this presentation on the regionality, and that is what it is.
Micro 1.
Bonjour, Monsieur Dubé, Olivier Bachand de Radio-Canada. Vous parlez de prévention.
You were talking about prevention. Maybe something is going to be symbolic today. Could you confirm to me that the three ministers of your government that are in isolation right now, Minister Bonnardel, Jolin Barrette, and Rouleau, following their contact with the mayor of Longueuil who was declared positive to COVID-19? And what do you think of all that? Well, the answer is yes for two of the names that you named. I don't know yet about the third person. I know that it is the case for Mr. Bonnardel and Ms. Rouleau. I don't know, maybe you have developments that I'm not aware of on Simon Jolin Barrette. But what I think about that, it shows everyone how this is virulent. I think that people can see that despite often all the precautions that we can take, and I know I experience it every day with my colleagues, I am very sad. For my colleagues, I hope that the news will be good, but I'm thinking about Madame Parent, whom we know very well, whom I see regularly. I haven't seen her over the past few weeks, but I think that it shows everyone that even when we take all the precautions, we said it, this virus is a traitor. And I repeat it, if people thought that it didn't exist, who are trying to convince us that it's just a big, cold, well, I think that we've had proof over the past week that that's not the case. So we're going to cross our fingers for our colleagues and hope that Madame Parent gets through this as quickly as possible.
S'il vous plaît, c'est une seule question par journaliste. On va pouvoir revenir si jamais on a le temps. Merci beaucoup.
Merci.
Oui, Ariane Lacourcière de la presse. Je me demandais s'il y a un
I was wondering if there's a common denominator to the cases that are more and more numerous in the past few weeks. Are we learning things with those cases in terms of aerial transmission? There's studies internationally. Is there a common denominator? I'm going to let Dr. Ruda answer. What we realize is that the cases are in the community. So really, we don't have a profile right now. You saw in the first wave, we had a profile, CHSLD, and that's where it happened. We're all confined. So we didn't experience what is happening right now at a low level. What we have is we have children who caught COVID from their parents because there was a party or something like that over the summer period, and they went to school, but thank goodness it didn't get spread in the school. We see things associated to family gatherings of 14, 15 people where there's 10 people contaminated. There are situations in bars. You see what we experienced with the karaoke bar, and there's also businesses as well, where there were, for example, in retail, 1 or 2 cases, very often that are not transmitted to the clientele, but it's really people who caught it in the community and who transmitted it. Lunchtime, particularly in different places like in schools and CHSLDs, it's dangerous because people, when they are at work, they apply the measures, and then when they go into the kitchen, it's almost as if they were in a family at home. They remove their mask, they talk and they eat, and that's an element. And now, that's another thing. We're going to be going into our homes. We did a lot of partying outside. Now people are going to be going inside. And it's very difficult in a family context to maintain the 2 meters. Maintaining a 2-meter distance is not natural. Even me, it's like, so we're always, now I see you all with masks, and we realize that the measures are applied. We're at a 2-meter distance. So that is why it's so important, the message of the minister to say that the power is in your hands, because if the sum of those cases, and as far as the ministers are concerned, these are contacts of cases, that doesn't mean that they have developed the disease. If the measures worked, it won't happen. But it's a traitor, whether it be your brother-in-law, your sister-in-law, they can love you, but they can still have the virus and not have symptoms. So right now, these are outbreaks that we can still control. We are in these little waves. But if it starts surging, that's where we'll have problems. That is why it's so important that people see that these are, when we go from green to yellow, it's nothing silly. If I could just complete one point, we started over the past few weeks, once per week, to give you 3 graphs, and I think that they will answer your questions. So we're giving the statistics per age, per region, but also per sector of activity, which is more specifically to do with your questions. So what we'll be doing over the next few days, we'll see for the same weeks, the ones that end on the Saturday, we'll be giving you that data. So you can see that right now it really is spread between community, work, it's all of that. There's not one sector that is more affected than another, and that is what we have to follow. So that's why we're giving this message. We have to be attentive everywhere. There's no place where the virus is better hidden than others. As far as air transmission is concerned, airborne, we know that it can exist, but it's not the driver. It's not the main driver of the disease. That doesn't mean that it isn't good to ventilate a home and to air it out. I think that's a good practice to even just remove toxins and things like that. But it's not the driver of the disease. If you respect the 2-meter distance, you put on a mask and you wash your hands, the airborne might have an effect, but much lesser, a lot fewer cases. Not that I want to eliminate completely, but let's concentrate on the 2 meters because that aspect is dangerous. I would like to know a little bit more on what it means for citizens to go from yellow to orange, because now yes, we can see colors, but it's not very concrete. A region that goes orange, what does that mean? Gatherings at home are forbidden, or there are businesses that will be closing? Well, we have our expert here who worked really hard on that. Maybe Dr. Litvak, you could give examples. It would be helpful. Yes, so when you go to the orange level, what we want to do is set up restrictions and prohibitions, but as selectively as possible to interfere as little as possible with people's daily lives. But when we get to those levels, basically we are at a transmission level where we have to set up measures to try to slow down the transmission. So to give you a few examples of things that could be set up at level orange. For example, decrease the maximum number of people that are allowed in a private gathering. For example, decreasing the number of people allowed in public gatherings. And I'm going to say, once again, in a very selective way, there's possibly certain places where we know that the risk of transmission is significant and that at orange level, we might decide that we temporarily need to close something or prohibit something. But all of that is going to depend on the analyses and the results. So we really are wanting to see what the situation that we're observing, where the transmission is taking place, in order to be able to make the right decisions. And if we have to set up limits, we want them to interfere as little as possible with people's lives. And it's pretty much the same thing for businesses. There might be certain kinds of activities, I would say, particularly at level red, certain kinds of businesses that we might want to close, but it's going to be a lot less than in confinement, and it will only be when it is totally necessary in order to slow down transmission in the entire population.
Okay. Bon, milieu au sens de secteur, activité.
I mean sectors, activities. So I could give you an example, perhaps when we're talking about a gathering, a public gathering. Right now, we have a limit of 250 people, and it's applicable to different venues, different areas. If we get to red, perhaps we'll want to differentiate different places where the risk isn't the same. For example, 250 people who are in a very controlled environment where they're seated in fixed places without talking or moving, it doesn't have the same risk as 250 people who are in a big room where they move around, interact among themselves. So you can see, for example, a showroom compared to a party or a wedding. Well, these are two environments in which the risk is not the same. So that means that as we go forward in the different levels, that means that we may have different things that we will apply to places where the risk is higher and where we can't control the risk despite everything that we would want to set up. I understand that between levels yellow and orange and red, things get tightened a lot, but could you specify what the difference between green and yellow is? Because I don't see that there's a big difference for people. Well, I'll try, but I would like for Dr. Lidbach to complete. For me, I'll give 4. There's going to be more communication and actions on the part of public health, and that's clear. You'll see more inspections. People are going to be in the field a lot more because we do have a limited number of people. And when I told you, it means that in 4 regions there are fires raging. And it means that people will be able to see that they are in a riskier zone. They'll be able to see it, they'll be able to feel it. And then we'll invite more specific groups to go get tested. We can see, when it happened, as you saw in the Quebec region, then we have to say, okay, in such and such a region, what happened with the karaoke bar that is unfortunately, and I'm not scared of saying it, that is going to have an impact on schools. It's really sad that they are getting to that in Quebec. So we're going to have to say in that region, with a regional director, there's an impact. We have to tell those people, go get tested. You are in such and such a region of Quebec, because that is one example. I would say that what I explained earlier on, that I was hesitating in the question, there will be extra tickets given out. That's for sure. We've been very indulgent up until now, but now we're going to be giving more. Because if, unfortunately, people don't listen, we're going to have to go to that step. It's unfortunate, but we had warned people ahead of time, and now we're saying you're in yellow. Well, be conscious of the fact that if you don't respect the rules, and that is why we asked the Deputy Premier to get to to be able to talk about it over the next few days. And I will say, and Dr. Lidvac will help me answer, but the fourth point is to ask our business owners, because you said, a few months ago, why are you putting pressure on business owners and not individuals? Well, now we're telling you that we're going to go more with individuals in those zones, but of course we're going to keep asking business owners to continue helping us. So to summarize, I think that people in those regions are going to feel it, but I repeat, this is a pre-alert mode. It's easy to get back out of it, and that is what I want the message to be this morning. You are responsible for your region. Talk about it with the elected public elected officials. It's in our hands. It's not going to fall from the sky. I think that Mr. Dube explained it very well. The yellow level has to be understood as being a message that we're giving the population of saying, careful, we're not going the right way, and if we don't increase our level of vigilance, all of us together, we will get to a level where we're going to have additional restrictions. So at yellow, we don't have new restrictions. It's the same rules for everyone, for the entire public. We can continue doing the same things. However, there are a series of efforts that should be deployed to make sure that those rules are respected, understood, and followed. And the minister just gave good examples of what those efforts might be. And I would like to add, and the minister said, going from yellow to green can be done. It can be done by applying the measures that we wish to see applied, but when we go from orange or red, it's going to require a lot more effort to be able to go back. So it's as if I was saying, we don't have orange in Quebec. It's green, yellow, and say red. But when you're on yellow, we can't continue accelerating. You're supposed to stop and come back. So I find it important that this be understood because it is reversible. The cancer is not yet dangerous. It can be treated.
Micro 1.
Oui, bonjour. Amélie Pineda du journal Le Devoir. Vous avez beaucoup parlé.
You talked a lot about citizens' responsibility with the alert system given in each region. Right now, there are 4 regions in the yellow. We understand that Quebec, unfortunately, the karaoke event contributed to that. In the other 3 regions, were you able to pinpoint in what sector of activity that transmission brought for those sections to be classified as yellow? Just to give you an example, in the Eastern Townships, there was a territory in the city, 2 territories where there were more vulnerable clients. So a factor of understanding, ethnocultural, and all that brought about community transmission. So that is going down. Again, Dr. Poirier was telling me yesterday that it's being brought under control, so it can be very different from one place to another. And you talked about Laval with private parties. Yes, there's also private parties. Sorry about being so direct, but yeah, there are parties that can take place that create 15 or 20 cases. Weddings, we've had situations that even involve different regions because people go from one region to another. So we truly have that profile that we call community profile. I don't know if you understand what I mean. There were a few cases in restaurants, but there aren't big outbreaks, I would say, massive outbreaks that make it that we would need to stop all sectors of activity. But we have to reinforce the message, and we can't stop, because that's what the problem is, that when we don't see it anymore, we have the impression that it's finished, that it's over, and it's not the case. But when you see those parties or those weddings, those Quebecers don't understand your message. How do you interpret it? Well, people go back to the normal way that they function by forgetting things. It's so easy. I mean, it's clear, photograph, media, our behavior is generated by the fact that our living environment tells us, whoa, careful, we need distancing. If you end up in a party among friends, among people, those codes aren't there. It's even difficult in a wedding, if it's a cousin you haven't seen for a long time, to not go a little bit closer. And even I'm sure that people might hug, or give themselves a kiss thinking, oh, it's no big deal. That's the problem.
Phil Carpenter, Global News. Could you please explain how a system like this would work in a place like Montreal, where the situation in one spot or one borough might be completely different from another?
Yeah, and if I need help, I think that I had a question earlier. Do we have a full region approach or a sub-region approach? I think we're going to go for both. To start with, like Montreal is a good news today. Montreal is not in the yellow. Montreal was in the yellow a few weeks ago, and not only the numbers, but all the qualitative factors have been positive in the last few weeks. Now, within Montreal, we also going to look, and that's what we were discussing with Madame Plante yesterday, how can we have a more targeted approach with certain sub-region so that we can be, and I've said that many times, ahead of the parade. And this is the reason why we have this system here, is to say, Madame Drouin of Public Health in Montreal will be discussing with the team, with all the teams surrounding Montreal, to make sure that we looked at it with a more targeted approach. So I think it has worked. I think we will need to have those discussions to make sure that we look at region, but sub-region as well. Okay, thank you.
Rob Lurie from CTV News.
Good morning.
For Mr. Dube, and also I'd like to hear from Dr. Litvak on this. Why the need for this type of system? We all already know that there is a lot of information in the media. I want to know, do you believe this is necessary because as we enter the second wave, are we suffering from COVID fatigue? Is that why we need this?
That's a very good question. Can I say that I think one of the remedy is communication. I think communication is a key element to making sure that we don't get into the high level of that second wave. You see how sensitive that is? Remember, 2 weeks ago, we were in the 60 cases per day. We're now over 200. So I think communication is one key factor. Why do we say that? Because also of, I hope that's a good word in English, but previsibility. I think I remember in the last 2 days, I've been making a lot of calls to municipal levels of elected people, and they were saying, we love this because now we know where we stand today. How can we explain it to the population? Because there is a fantastic leverage that we can have with the population if they understand where they stand and that the solution is in their hands. So I go back to communication at our level at government, but also at municipal level. And this is the reason we're going to ask, maybe I repeat myself, but we're going to ask at regional public health to be in communication with mayors and MRC to explain how the system that has been developed works. So if they know, and they know they have the strength in their hands to make that difference, I think we can, again, I'll go back to that curve, stay in this minimum level as opposed to increasing, which we don't want to go to.
And Dr. Litvak, about that COVID fatigue question, is that the importance here?
I think it certainly is one of the elements. You know, it's important that we understand that COVID is going to be with us for a while to come, potentially many months. And during that time, the situation is going to keep evolving. So right now, we're preparing for a potential second wave, and we're worried about a potential second wave this fall. But over the next 12 months, there might be several smaller waves. And there's going to be an ongoing situation that's going to be changing in an ongoing way. So I think it's important, yes, that we try to avoid COVID fatigue because, as has already been said, the virus is there even when we don't see it very much, and we cannot let down our guard. But we also need a system that's going to inform the population as the situation changes. What is the risk level? How is it changing? So the whole idea of having a system like that is so that people can understand in advance what are the messages that are going to be given, when will they apply, and what's going to happen, and at what point are we going to have to start restricting daily activities a little bit if we need to reduce transmission further. So we need a system that's going to be with us for the months to come, and that people are going to gradually understand, and that they'll understand what the impacts will be, you know, if transmission continues to rise.
Micro 2, s'il vous plaît.
Matthew Lapierre, Montreal Gazette. Is there a worry that if the current trend continues, we're going to need the orange and the red alerts for some regions in the coming months?
I hope not. That's exactly what we're trying to prevent. Thank you for asking that question. That's exactly the reason we're here today, to explain that it is possible that we could go there, especially in certain regions, but I think we can look at the positive side of it and saying that if people, because we understand, we gave example even at M&A that, we can contract the virus. So, but I'm just saying, if there is one thing that I would like people to retain today, it's in their hand, and we don't want to go there, and this is their responsibility. So we don't want to go to red.
Micro 1.
Simon Nakaneshny, CBC. You talked a lot about communication. You say it's in people's hands. At the same time, at what point do you think the carrot approach reaches its end and the stick approach needs to happen, where you need to put the hammer down on some of these situations like you spoke to deter people from getting to the yellow? I mean, is it enough to just keep asking people, or is it time to start putting the hammer down a bit?
The answer is it's a difficult equilibrium to, this baton and carrot, but stick and carrot, sorry. But you're right. I believe that in the last few months, we have been more on making people their decision themselves, because we were in the summer. Our conditions were good. You remember, we have been, but now that's the reason when I was talking, as an example, talking with Madame Guilbeault of Public Security. She will come up in the coming days, now that we have announced this program, how that she can match the level of contravention, the numbers of penalties that can be made in line with those colors, in line with those alert systems. So I don't like that, but I think our government is willing now to go there if we get into those type of. So I think that answers your question. That will be more in the tough part in the next few weeks if we need to go there, because that's we don't want to go into the red zone for sure.
Thanks.
C'est ce qui met fin à la conférence de presse.
This puts an end to the press conference. Thank you very much for having been here. Thank you, everyone. Have a good week, and see you all next Tuesday.